Speaking of de oro, Sydney, which food gets your medalla de oro or gold medal? California rolls or Texas bar?
Actually neither. I'm a vegetarian, so I don't eat California rolls or barbecue.
Okay, well, what gets your medalla de oro then?
Food specifically,
Food specifically.
I really like tacos. There's some really good tacos in Austin.
What vegetarian tacos are good? Because honestly, that is something I haven't considered before, and honestly,
Oh,
I'm down to
really?
try. Yeah,
So many. So Veracruz has a really good taco called El Diferente. It's very good. It has like refried beans and cactus in it, and it has potato and um, mushrooms. It's really, really good. But we made some tacos last night that were sweet potatoes, cashews, black beans, and zucchini.
definitely very differente, but I'll definitely whenever I get down to either California or Texas, I'll definitely try either one of those. This isn't a podcast that's about tacos though, nor about California rolls or unfortunately Texas barbecue. But it's how it's about the podcast where we chat with people who are shaping the future of health tech and med tech. With us today is the one and only Sidney Collin, the co-founder and CEO of De Oro Devices. Sydney, how's it going? What's been new with you since we last chatted?
So much. There's lots of things happening. Thank you so much for having me here, Jeff. I really appreciate it. I'm excited for the conversation today. Um, I mean, you know what the startup world is like. There's a million things happening at once, and I'm just trying as hard as I can to keep my head on straight.
What are the top three things that have happened since we last chatted? Because I'm sure that a million things have happened, but what's been most exciting or most terrifying for you?
Well, we're doing a big direct to consumer push right now. So we just filmed a TV commercial that's going live this quarter. Um, we signed a agreement with McKesson, so we'll be launching with McKesson as well, which is exciting on their consumer channel. So again, on the direct to consumer side. And we're seeing huge growth on our clinical channel, actually, which is really interesting because that isn't something that we were actively pursuing. We were pursuing the direct to consumer. Um, but we started to see a big intake in physical therapists and hospitals purchasing these for use in the clinic.
That's awesome. And for the context of those who don't know or I guess what McKesson is, what is McKesson?
McKesson is the seventh largest company in the US. They distribute a third of all pharmaceuticals in the US. It's a medical device distribution company.
So basically, you're swimming with the big fish.
It's a big deal for us, for sure.
That must be
Something that
super exciting.
thank you. Something that I should mention and is our, we just got awarded, we're a finalist in the Digital Health Awards, the UCSF Digital Health Awards for the consumer wellness category. So I just announced that on LinkedIn last week as well, which is exciting. And there's hundreds of companies that applied for that. So it's fun to see. And we'll be
Big stuff.
at the finalist event in health. We'll be exhibiting at health, the conference in Vegas.
I did not. Okay. That hell. I see. I always try to like visualize the word with its proper spelling with actual vowels, but apparently conferences can't spell with vowels. My bad. Uh, but beyond that, normally I ask the question I'm going to ask next to I guess move the conversation forward later in the conversation when we've discussed kind of your origins, etc. But I feel like you can handle this. How would you describe what your company does to a 5-year-old with only monosyllabic and bisyllabic words? Everyone has failed so far, by the way. So I'm really hoping that you can actually nail this.
We help you walk. That's how I would describe it. I can add a little bit more though. We help you walk with, I'm trying to make sure that I don't go over. We help you walk with laser and sound alerts or laser and sound cues, I should say, or actually there's a marketing agency that we're working with just came up with a really good word. Like, I'm not going to remember it. It wasn't target, it was signal, laser and sound signals that trick your brain into moving.
Hmm. And who does it help, or does what your device, sorry, I am post clinic, so my brain is very fried right now. Who does your device help the most? Who is that you, that your 5-year old's explanation? Who is that explanation targeted to? Wow, I can't really speak right now, can I?
So it was built for people with Parkinson's. So that was originally our target market, but right now we're actively redoing all of our messaging because we've been publishing research outside of Parkinson's and stroke and cerebral
Interesting.
palsy and multiple sclerosis and MSA and traumatic brain injury. So there's many, many, many more applications outside of Parkinson's, but really it's anybody with a mobility impairment, such as, uneven gait asymmetry, ataxia, scissoring, any sort of abnormal gait patterns. We can use our visual and auditory cues or signals to help normalize those gait patterns and allow someone to walk safer at home.
Hmm. So, I mean, why are these signals useful? Is there any way that you can break it down to us, the audience, myself, as to why these signals are needed? Is there a specific target, like neuronal loop, that this device targets to make walking easier when it's difficult for this whole range of neurological conditions that you've mentioned?
Yeah, absolutely. It's pretty simple. I mean, what we're doing is targeting the goal-oriented neural pathways in the brain instead of the automatic neural pathways in the brain. And that allows you to kind of rewire or rethink how you are moving. So just by setting a goal, we change the intention behind the movement. By changing the intention behind the movement, we are activating a different part of the brain to initiate that movement. So in people with Parkinson's specifically, what happens with freezing of gait is there is a specific neural pathway in the brain that gets damaged or disconnected. That makes it so that when your brain is sending that signal to initiate movement, it just doesn't get to the motor neurons to activating your muscles. And this is that automatic neural pathway that, if when you and I think, okay, I'm just going to get up and walk over there, that's the automatic neural pathway that allows you to say, okay, right foot, left foot, keep stepping, activate these muscles. Um, that pathway gets damaged for people with Parkinson's. So what we want to do is activate a different neural pathway to be able to initiate the same movement. So in simple terms, we're activating goal-oriented neural pathways instead of automatic neural pathways.
Mhm.
Does that make
So
sense?
that makes sense. And I guess, is that same pathway damaged in all the other neurological conditions that you mentioned, or is there an unexplained mechanism by which there is more generalized applicability for your device?
So it can be in stroke and in some of the other neurological disorders, it can be the same neural pathway. It's not always though. And really, these visual auditory cues can be used as a tool, whether somebody has a neurological condition or not, to be able to create kind of gait symmetry. You have a target on the floor, you say, step to this line that ensures that you have a certain stride length, so it allows you to practice being able to walk with this longer stride length than when you were shuffling before. So for some people, it's kind of just used as a tool, as a goal. For some people, it is, physically bypassing a damaged neural pathway in the brain.
Hmm. Hmm. That's absolutely fascinating that there's generalized applicability, and that it, I guess, solves one of the biggest issues that Parkinsonian patients face when trying to get around. Because if you think of it, mobility is so very important to, I guess, everyday life. If you can't move necessarily by yourself, then, I mean, your quality of life goes way down the drain.
You just become much more dependent on the people around you, which is hard. It's hard physically and emotionally for people. For Jack, this device that Jack is the person I made this device for originally, local veteran and slow. Um, but for Jack, it was, the difference of being able to go to the bathroom by himself or needing his wife's sanity to push him to the bathroom in a wheelchair. It was the difference of being able to go on a walk with his wife or have her push him. it's these little things that make a really big difference in independence and somebody's kind of emotional feeling like they're a burden on somebody else. And if we can impact that, if we can allow people to be able to do something themselves that they couldn't do before, that has a huge impact on people and their caregivers.
Hmm. Yeah, I can see how logistically it improves things so much to have someone be able to get around, get to the washroom by themselves, and emotionally being able to walk alongside a loved one instead of being pushed by them. There's just something there that feels different, and I absolutely see the impact that what you're doing has on so many patients who have poor quality of life because of Parkinson's and other associated neurological disorders. So, I mean, let's flash back way back when, not when this all started, but before it all started. You told me when we chatted about, I think a month or two ago, that you did ballet for 10 years, then you quit because you had to make the decision between school and ballet. I mean, this is probably an overused trope of a question, but what did you take away from that experience, either of having to quit something that you'd stuck to for such a long time, or just the discipline of sticking to ballet overall?
I think there's a lot that I learned in that whole process. I think ballet, especially with the San Francisco Ballet, it's very traditional. It's very, um, the rules that you follow are very strict. Provides a lot of structure for a kid. So I think that I learned a lot from that and kind of learning to just push yourself more than I ever had before, um, in different ways, in pushing yourself to practice every day and pushing yourself in the class to, do the triple pirouette that you didn't think you could do. Um, I think there's definitely a lot of learning there. And then just on the, pushing yourself in any sport, um, but also on the performance side, that's a whole other piece of it. That's very interesting. Learning to perform in front of a group of people, learning to, you know, if you mess up, don't show it on your face, and learning to work with the other people on the stage. If the person in front of you messes up, you follow them, which is just, you know, it's just interesting.
Was ballet where, I guess, your interest in movement started, or am I just reading too much into it?
Not particularly. I think I've always thought that exercise is really important. I even after ballet, I mean, I do all sorts of exercise to make sure that I'm moving every day. Whether that's, going to Orange Theory classes or I rode a 75-mile bike ride recently. Um, just doing anything, all sorts of activities to move my body, I think is really important. I don't necessarily think that that's linked to ballet, even though I did have the the habit, I should say. I was gonna say hobby. I was like, that's not the right word. The habit of exercising every day, and I think stopping that is a very strange feeling for your body. So I've always been very
Yeah,
active since then. And I see how
yeah.
much that impacts my physical and mental health. So I've always seen for myself how important that is. And then you start to look into the research and you find exercise is the only thing that has been shown to slow the progression of Parkinson's disease. And there's so many health benefits for people outside of Parkinson's. It's really incredible.
Hmm. Hmm. I mean, for one, I took an Orange Theory trial class once, and just never again. It was the level of competition that that board inspires in you is it's extremely motivating, but you're just so gassed at the end. It's. I mean, I guess that's the point. I guess that's the point.
That
But
is the
that's beside the point of what we're talking about. So you ended up choosing Cal Poly after like quitting ballet. You ended up working with Mencia Technologies, a company that develops brain computer interfaces in France. And that company specifically designed devices to provide neurofeedback for the treatment of CNS disorders like ADHD. That seemed like an incremental approach to the use of a technology such as neurofeedback. And that seems to contrast with what Elon Musk, for better or for worse, has done with or is aiming to do with Neuralink. So I just wanted to hear what your perspective is when it comes to incremental or moonshot approaches to health tech. Which one do you think is the most appropriate approach? I guess generally, because I mean, there's no one size fits all, is there?
It's an interesting question. I think both. I think you have to have a bigger kind of mission, a bigger purpose for why you're doing something and where you want to go. Yet there are a lot of smaller steps to get there. And sometimes, like this device that we have, it's always relying on metronome. It's not hugely innovative. We're not, creating the next electric vehicle. We're not creating the next, you know, device that will ship people to the moon or ship people to Mars. It's something that is pretty simple and but so effective. And that's something that was so frustrating for me when I was looking into the research. These visual monitor cues were standard practice in any physical therapy clinic. We had over 100 peer-reviewed articles showing the efficacy. We know that these visual monitor cues work. And yet there wasn't a way for people to use these cues at home. It was so frustrating to me that something like so simple. I made a prototype in a summer one time, simple, easy to create, easy to get out to people. We can go direct to consumer. I shouldn't say easy, there's a lot to think about on the sales and marketing side, but something that's so simple and so well known to be effective doesn't exist in the world already. I thought that was so frustrating. So I think that these, small, not super, groundbreaking technology can really have a huge impact on people's lives and need to be out there. And we also need the technology that people don't think is going to make it. And yet we put in hundreds of millions of dollars to test it out because it would be that impactful if we could. So that's what I think we do with a lot of like the clinical trials that we do, with a lot of research is testing out, okay, we don't know if this is going to work, but let's put in hundreds of millions of dollars to test it out because if it did work, it would change people's lives.
That's fair enough. I guess maybe to reframe that question then, um, now that I'm reflecting on what you said, it's true that even like a reusable rocket is an incremental step forward, technically, from a rocket that already exists, or an electric car is an incremental step. You're just putting an electric motor into a car. But really, what really matters is how you nail the go to market in terms of being able to actually execute putting the device or changing behavior to use that technology to make that massive impact. Is that correct?
Yeah, I think that's a fair statement. I think that, we can have all sorts of technology, but what really matters is how is this going to affect the people that are going to use it and what's the impacts that it's going to have. That's what matters the most to me. Because when we were developing this, trust me, there were lots, hundreds of features I wanted to add, and I wanted to keep working on it, make it this like really cool device that could connect to your phone and collect all this data. And I think that there's a place for that, but for this population that I'm going after, it means a lot to have something that's just really simple and easy to use. That's really as low tech as you could possibly make it. Make the buttons big, don't make it as pretty as you can make it. Make the buttons big and easy to use because that's what's going to, be effective for our target customers.
That's fair enough. I think designing for a geriatric or even movement disordered audience must be so different from, I guess, the standard, I guess, way you design for the generalized population. And you just mentioned some ways in which it differs, but did it take a lot of deep thinking to go through that, or what was that thinking, or was that notion there from the start?
Sorry, can you repeat the question?
Oh, so what I had said was basically you're absolutely right that seniors and populations that are movement disordered uh, absolutely are different from a generalized population to design for. Was it a series of trial and error that through which you found the proper way to design your product for your target consumers? Or was it something that you knew from the start because you had it in with the Parkinsonian community?
A lot of testing. I mean, we designed this with a person with Parkinson's, right? So there's a lot of testing with him and with the Parkinson's support group locally where we showed the company. Um, but there was a lot of testing after we had our first prototypes. There was a lot of testing after we had our second prototypes. Um, we still are constantly doing research to understand, first of all, how to get information out to our population. ARP does a lot of great focus groups, and we're actually an innovation labs company for ARP. So they'll do focus groups and ask people about our technology. We'll get a lot of great information from that. But it's yeah, a lot of testing, a lot of putting together our own, focus groups, beta users, all sorts of different types of testing. And even now with the
Hmm.
product out on the market, we do a lot of customer surveys and call and interview our customers. We have a customer advisory board that we put together anytime we want to do any design changes.
Hmm. So it seems like it's like an iterative process, despite the fact that you already have the product market. And that's super interesting because that allows you to continue to figure out how your product should continue to evolve as you, I guess, touch more of the population with what you've developed. But speaking of, I guess, customer advisory boards, your first customer advisory board was Jack Brill, or is Jack Brill, a veteran who suffers from Parkinson's disease, who you met before you left Cal Poly. He seems to be pretty instrumental overall, to be totally frank, to your trajectory as a founder. Which two moments best encapsulate how Jack inspired and continues to inspire the work that you've done with your company?
Two moments. Is
Arbitrary
that what you're
number.
asking? Okay.
Two moments, yeah.
Um, I mean, everything that that we do is inspired by Jack and all of the moments that we had together. So it's really hard for me to pick two. Um, so I mean, Jack helped design this whole thing. So he came to us and asked for help in creating this type of technology. Um, I don't think I could give you two moments that inspired me to do this, but he definitely was the person that pushed me to start this company and to get this technology out to more people besides just him. He brought me to a support
Hmm.
group, a Parkinson's support group, to show off this new technology and, introduced me to 20 or 30 other people who also lived with Parkinson's disease and suffered from bridging of gait. And that moment itself was instrumental for me because, meeting people face to face who need this technology, are asking for this technology, made it really difficult for me to not pursue it and not get it out to the people who need it. Because I couldn't live with myself if I looked these people in the eyes and said, I have every ability to make this device for you, but I'm just going to. I don't feel like it. I feel like going to go join this other biomedical company. So I think that was a really big moment. But I think just Jack in general was a very giving, selfless man. And the more that I learned about his life and everything that he had done, from his volunteer work to teaching, he was an engineering professor, and just the way that he interacts with the people in his community, like it's so clear how much he cares about everybody that he meets in the world. He ended up starting an investment company that was an impact investing company, one of the first impact investing companies that existed because he really wanted to make the world a better place. And that was a really magical and beautiful thing about him and definitely still inspires me today. And I hope that we can make him
Hmm.
proud with what we're able to accomplish with this company.
I think you have to a great extent so far. The fact that you've managed to accomplish so much in such a short period of time is, I mean, super commendable. But one thing that I've noticed is that in the entire conversation that we've had, you've mentioned that you worked with patients directly to develop a device, uh, a company that was founded by, if I'm not incorrect, two engineers, and that was spread through patient networks and now is being distributed by McKesson, a company that had like dominates the pharmaceutical distribution market. But nowhere, or I guess not nowhere, but perhaps hidden in this conversation is the role that clinicians take. What I've heard or seen a lot of the time is examples of how clinicians are kind of linchpins to, I guess, the steps that biomedical device companies uh, need to take to get to market. So, was there a role that clinicians had, or I mean, is there a different approach that your company took that didn't necessarily necessitate the formation of these often hard to form relationships with physicians, with clinicians, otherwise who are super busy?
We have amazing relationships with clinicians. I mean, physical therapists are huge advocates for our product. We're in about 100 physical therapy clinics across the US right now, including the Muhammad Ali Center, Harvard, UCLA, Mayo Clinic, Cleveland Clinic, all of the leading research institutes. And they use our product in clinic right now and recommend it to patients. So that has been definitely, I wouldn't say instrumental because that's not our main sales channel. It's actually a really small sales channel for us, but it does help us spread awareness. It adds a lot of credibility for people to go in and see NextRide being used by their physical therapists or by their clinicians. And it gives us a lot of great feedback. Like that, those relationships are what allowed us to really understand that NextRide is not only used for Parkinson's, but it's also, you know, able to help and make a huge impact on a lot of other mobility symptoms or mobility diagnoses. And so we published a case study with Bellevue Hospital. We're in the middle of publishing a case study with Vanderbilt Medical Center and with Paragon Management Skilled Nursing Facility in New York, all in different mobility disorders outside of Parkinson's. One person was in a motor vehicle accident. One person was stroke. One was MSA. So our relationships with clinicians has been really instrumental in helping us understand how the next drug can best be used or with who.
hmm And I mean, to build on that, then why continue to publish? Is the publishing kind of a means by which you can demonstrate the value and new use cases of your device? Or is that publishing necessary so that you can demonstrate the safety and efficacy for your device for regulatory purposes?
So we don't need it for any regulatory purposes. It's really just marketing. I mean, it's really just we want to share stories in a clinical way. We want to share how effective NextStride is. We want to build credibility ourselves through putting together this research. Um, and that will help us. We'll be able to leverage that to be able to build credibility with hospitals, with elderly care facilities, with some of our B2B partners. Um, but generally, consumers don't really care about the research, which is disappointing for me because I come from a research background. I love the research. But generally, what consumers want to see is videos of it working in different situations with different people. They don't care as much about published clinical trials and case studies and whatnot.
hmm So it's kind of a two-pronged fork. You got to target the patients through targeted advertising, through videos, etc., but also clinicians so that when patients bring the idea to the clinicians can point to evidence and say, hey, this actually might be a good idea, instead of being like, well, what's the evidence?
That's exactly right.
All right. Well, I mean, you just mentioned stories, not only in videos, but also stories in the form of research, case studies, peer-reviewed articles, etc. Stories can also be used to raise rounds of funding. And you've told us the story of Jack and how Jack inspired so much of the work that you do. But what are the other hard facts, the numbers that convinced you and that you use to convince others that the work the Oro is doing has legs?
Well, there are over 100 peer-reviewed articles that have been published showing the efficacy of visual auditory cues in Parkinson's specifically. There are also peer-reviewed articles published showing efficacy in stroke and cerebral palsy and multiple sclerosis, in PSP, and a number of other areas. There's actually one research study that I can think of, probably more now, that shows the efficacy of these visual auditory cues in the elderly population in general. And so there is a plethora of research out there, an astronomical amount of research out there showing the efficacy that other people have done. Um, and then we started to publish our own research, right? Showing how effective the next ride is in a number of other areas. And also specifically for the skilled nursing facilities. Okay, how can this help you
Do
get
skills.
better patient outcomes faster? How can this help, once people are out of the skilled nursing facility, help them be able to maintain their physical therapy, maintain their
I know.
mobility so that they don't fall again and they don't end up back in a hospital, but they're able to remain a part of the community. Um, but if you want me to cite some of the research, these visual auditory cues have been shown to reduce falls by 40% for people with Parkinson's, reduce the duration of freezing key episodes by 69%, and reduce the frequency of freezing episodes by 43%. And all of
But
that is
what's
cited on our website.
if you were to cite the size of the market though, or in more healthcare terms, how many patients this actually impacts? How many patients could what you're doing impact overall?
So if we just look at what's been published with the Parkinson's with freezing of gait, stroke with hemiparesis, which is the symptom that we go after, cerebral palsy, people who are ambulatory, multiple sclerosis, people who are ambulatory. Just with those diagnoses, that's 26 million globally and 4 million in the US.
Jeez, that's a lot. That's a lot of people.
And that's just with what has been published, right? We're doing our own research outside of that.
hmm So it seems like there's a pretty significant impact to quite a few people, quite a few, it probably isn't actually, I mean, a lot of people in the community overall. But I mean, you know, making all this change requires, to say the least, quite a bit of funding at the start to make sure that you're able to fund the research, as well as to be able to fund the marketing teams that you mentioned that have helped develop the marketing so that you can distribute the product that you've made so that you're able to further fuel more research and more marketing. That initial funding can come from angels as well as VCs. You've raised 1.5 mil from angels and 3 mil from VCs. Correct me if I'm wrong if you've raised more. But between the two, what is the difference between pitching to angels and pitching to VCs?
Generally, there's just a lot more variety with angel investors because it's just individual high net worth people
Yep.
um, who are making the decision themselves whether they want to invest or not. And so a lot of angel investors, especially early on for us, they invested because they had some connection to Parkinson's and they really cared about the problem. And they thought that we had a solution that could make a big impact on people. And so it was, their decisions were much more emotional and didn't have to be validated as much with, uh, the data on acquisitions and the data on, okay, here are 5 other companies that have the same business model that we have and they've been successful. They didn't need all of that information. They could make decisions much quicker and much more based on an emotional pull. Whereas VCs need a lot more of that data because they have to go report back to their LPs. Here's how this company fits into our thesis. Here's how we're going to make your money back in, call it a 10-year fund in the next 7 years. And, it falls within our risk tolerance and it falls within people have within their thesis, they have like sectors that they'll invest in. They also have, um, stages of companies that they'll invest in. There can be certain business models. For example, a lot of VCs need to see some sort of SaaS component to it, some sort of software. Some VCs will only do hardware. So there's all sorts of criteria that you have to meet to be able to
Niches.
put into the thesis. There's also just a lot more data and a lot bigger picture. Like angels, when I talk to angels outside of what we just talked about, when I talk to angels, they say, okay, how can you get to your first million? And they really want to dive into that. They really want to dive into like, okay, what are you going to do in the next year? VCs want to know, okay, I think you can get to your first million in sales. I think you can get to your first 5 million sales. How are you going to get to 100 million in sales? Like they want to understand the bigger picture. They want to understand the moonshot, not how are you going to be successful in the next year.
That's fair enough because they have, I guess, many different funders to, I guess, go back to and to report to. So their thinking extends beyond the current year. So that contrast definitely makes sense when you think along the logical consequences of how these different, I guess, people get the money that they're investing with. But speaking of, I guess, investing in your company and the results of that investment, how do you plan or how are you already getting your device out to patients? You mentioned that the clinical route certainly is one way that you're doing, and you mentioned the DTC route or the direct to consumer route. What do you mean by the clinical route? Do physiotherapists, physical therapists, otherwise like prescribe these devices? Could you clarify how exactly you're going to market? Because it's a little fuzzy to me.
So we have a couple of different channels. Our biggest channel is direct to consumer, so people can go online, purchase on our website. We also sell to hospitals and physical therapy clinics. We sell to the VA. Our device is 100% covered by the VA for any veterans, so the VA will order from us directly. And we sell to distributors, both
Hmm.
internationally and domestically.
Hmm. And how long did it take you to build up these different channels, or were certain channels, I guess, already built in, especially because you had Jack and the communities that came with him and his connections pretty early on in the formation of the company?
Yeah, what's interesting is when we got out on the market pretty early on, we had international distributors coming to us saying, hey, we can handle all the paperwork if you let us sell in Australia or in New Zealand or in Denmark or Sweden. And so there was really not a whole lot of downside for us. We looked into the company, we interviewed some of the products they already sell, asked, is this a good partner for you, et cetera, et cetera. We did our own due diligence. But there wasn't a whole lot of downside for us since we weren't planning on going into that market anyways. So that happened pretty quick, actually, those distribution partnerships internationally. And then domestically, we had relationships a lot. One of our advisors is a pretty well-known physical therapist in California. And so she introduced us to a number of people. And it just kind of grew from there a lot, really grassroots, working with 10 physical therapists at first. And then each one of those introducing us to two more. And then eventually we're at 100 physical therapy clinics. Something that really helped was we were on a wellness series that Dr. Becky Farley with Power puts on. Power is PWR, Power, what does it stand for? Parkinson's Wellness and Recovery.
What's with the lack of vowels?
um, but so she has a certification program that a lot of physical therapists go through to be certified to be able to specialize in Parkinson's treatment. And
Yeah,
so a lot of physical therapists follow her wellness series and webinars. So when we did a webinar with her, we had a lot of inbound interest from physical therapists as well.
that makes
So
sense.
yes, it takes time. I mean, I think if we had, you know, tens of millions of dollars up front, we could probably do it faster. Um, but for us, yeah, it took probably 6 months to get into 100 clinics.
That's amazing. That progress in itself must have been pretty exhilarating to see from the ground up. But I mean, to step aside from the, I guess, journey of how you've built your company so far and the stories that you've told, the impact that you've already made, the inner workings of how your company has evolved has been pretty interesting too. Specifically, to put it, the decision to go fully remote. And this has probably been talked to death on a whole bunch of mainstream channels so far. But really like with startups, I've heard anecdotally, there's not much data to support this, or at least I don't know if data to support this, but I've heard that that close quarters collaboration items that need to be completed now tends to drive innovation, tends to drive, a culture that I guess, begets excellence. Why do you think your company has thrived or has not thrived because of the changes that, you decided to implement?
So I think that you can definitely recreate that virtually, that like sitting next to someone and being able to just kind of turn your chair and say, "Hey, what do you think about this idea?" With a lot of tools. I mean, there's so many tools that you can use online. I do still think that in person relationships are built in person and in person meetings are important. So we do meet quarterly once in person with the whole team. But in general, I think that one, this allows us to hire the best talent because the best talent is all over the world. They're not in one place. It allows people to be able to be where they want to be. And it forces us to put in place a system of accountability that allows people to really have control over when they're working on what they're working on and what they're doing. And it's really results driven, which I think is beneficial for a company, especially at our stage. It's
Hmm.
not about,
That's fair
are
enough.
you in the office 24/7? It's about how much work do you get done.
Yep. Yeah. I guess that's a fair assessment. Like if you get the work done, then I don't care like what you're doing as long as you get it done within the target period of time.
Yeah. We had one of our employees she's in Dallas. She worked from Seattle for a week last week. I don't care that she's in Seattle. I don't care if she, on her lunchtime is taking walks around Seattle and checking it out. What I care about is if she's getting her work done. And she does. She goes above and beyond everything that I ask of her. And so, she could be working in Seattle, she could be working in Dallas, she could be working in California, she could be on the beach in Hawaii. It doesn't really matter to me. And it gives people autonomy over how they work and where they work best. It allows people to really understand themselves that way.
Mhm. I guess one last question is, as a founder who started their company in California, which to some extent has this, I guess, association as the mecca of startups, and as someone who bounces between Texas and California now, what are your favorite parts of either location or both locations as someone who is early in their career as an entrepreneur?
Good question. I think Silicon Valley has these kind of startup veterans, people who have done it 5 or 6 times, people who have been really successful. They have these, really well known, really successful VCs, and there's a lot of information and there's a lot of money in California. What Texas has is this new ecosystem that's being built and this environment of everybody wanting to work together to be able to create an ecosystem, a startup ecosystem that's going to thrive for a long time. And that kind of teamwork, that like bringing everybody together is a really cool thing that doesn't happen in every startup ecosystem. In Silicon Valley, it's become really competitive because there are so many people trying to start companies there. And there are a lot of people trying to start companies in Austin, but there's much more, we all rise together type of attitude here. Um,
Mhm.
I think that Texas, yeah, I think people are much more willing to work together, startups. And I think that um, VCs are much more open to having conversations with people outside of kind of the normal pipeline of how VCs are fed new deals. So for me, when I first moved to Austin, I think just like cold outreached one of the partners at a VC fund here in Austin, and he took my meeting. Like that would never happen in Silicon Valley, never. Like they wouldn't even see my message. Um, so I think that that's a pretty cool thing to be a part of. And probably as it grows, that's going to change, unfortunately. But I do think that there's a different culture here in Texas than there is in California.
Mhm. That's a really interesting insight, and I'll definitely have to try that for myself someday. But before we close, is there anything in particular that you'd like the audience to pay attention to or do if they want to help support what you're doing with the Aura?
I mean, I think generally we covered it, but people can find more information about what we're doing at getnextray.com. Um, and I think, I mean, really my goal here is to share our story to help other people understand that they also can make the jump to start a company to help people. And I hope that we can get more impactful startups out in the world that will improve the quality of life of as many people as possible.
That's fair enough. And you can find our podcast, Dear Listener, at howitsmed.com or howitsmed on any of the podcasts that you listen to. Till next time.